All right, guys, welcome to another episode of Rad Talk. In this episode, we discuss a little bit of MRI safety. We talk about calling in ultrasound techs overnight for stat exams. And then lastly, we play my favorite segment, Question of the Day. As always, if you enjoy the content, please like, comment, and subscribe to help grow the channel.
Welcome, all you wonderful people back to Rad Talk, where sports and medicine collide. I'm Dennis,
And I'm Gage.
and we're going to be going over, starting with some MRI interesting things. Gage is going to kind of go in depth about some MRI information that,
Yeah.
maybe the normal folks were just not aware of, and so he's going to tell us a little bit about it.
Yeah. What prompted it was was mindlessly scrolling through Reddit, a couple week or so ago,
Mhm.
and I saw an article about a guy that was he was accompanying his mom for an MRI. She was getting the MRI. He was just with her, and they let him come back, and he was carrying a gun, and the gun, because of it interacted with the magnet, it went off and killed him. And I know you and I have seen other stories about things as far as metal things, being brought near the. We can talk about those afterwards, but it got me thinking about like that the texts tell you these things like for a reason. Like they're not a fucking suggestion. Like this is, it's almost like the speed limit. People treat it as a suggestion, but then when you get pulled over, you're like, ooh, that's bullshit. No, it's law. Like
Right,
it says right there. So
right.
I kind of wanted to go over this because I'm sure nobody knows about it before, unless they've had an MR and they've had this discussion with the tech.
Hmm.
But it's a very important thing, and it's something we get tested on as radiologists. And I'm about to take my certifying exam, so I have to study this stuff. So this is why it's fresh in my mind. But you'll know some of it.
Hmm.
So the first thing is, I guess, is what is an MRI, right? I won't go into the details of like how it works, but the M in MRI means magnetic. So it's just a huge magnet. And the thing that people don't realize is how strong the magnet is. It extends outside of the room. So it's in a room. The magnet is in a room by itself, but the field extends. It's so strong, the field extends outside of the room. So if the tech has like like a metal clip or badge or something, it could interact still with the scanner. So the first thing is to know that it's a huge magnet. It's a very strong magnet. I at one point learned it's X amount of times stronger than the Earth's magnetic field. I don't remember what the number is, but it's much stronger than Earth's magnetic field. So that's the first thing. The second thing is when you get an MRI, they give you a uh, sheet, like a checklist sheet that you have to go through that says, do you have metal? Do you have this? Do you have that? Yada, 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 whatever. And you need to take that seriously because of the stories that we could talk about after we're done.
Hmm.
But it will ask if you have tattoos, if you have metal, if you have pacemaker, all the stents, all this kind of stuff. So the first thing you need to do is take that seriously, fill that out seriously, because the most common, I mean, do you know what the most common issue is with magnets that people report? Like the most common adverse side effect?
Burns, maybe.
Yeah, so it's burns. People get burned because the magnet or the coils get so fucking hot.
Mhm.
And people like me, you can't see them, but I have tattoos, and sometimes the ink has metallic
Mhm.
fragments in it, and it will interact. So yes, burns is the most common thing, but take that seriously. So the third thing is you mentioned briefly the zones. So we'll
Mhm.
talk about the zones because it comes into play when you go get your MR. So there
Mhm.
are four zones for MR. One is essentially anything that's outside of the MR suite. So if you're in the hospital cafeteria, if you're in the ultrasound room, if you're in the eighth floor, that's all zone one. And there's no restrictions. You can walk around with metal, with whatever you want. So that's where most people that work in the hospital spend their time, is zone one. The first crucial zone is zone two. And that's where they take you to fill out the sheet that I just mentioned. So it's the screening room, is zone two. So that's where you'll fill out the sheet. And then that's where the tech will tell you, hey, this is a big fucking magnet. If you have anything magnetic on you, leave it here right now. Like
Mhm.
that's the whole point of zone two, is to make sure you get the metal out of your body. So if you have anything magnetic on you, you leave it. If you have metal like stents or anything inside of your body, they'll see that on the sheet and be like, okay,
Mhm.
if you have metal, then they have to check, is it MR compatible, is it not, whatever. That's a different
Mhm.
issue. But the big thing with zone two is that's where you get screened, and people, you should not go past zone two with any metal. So Once you make it past zone 2, you've been
So,
screened.
so if I do have a stent or if I have a pacemaker or something,
Mhm.
will I even make it to zone 2?
Yeah, yeah, you'll make it to zone 2.
Okay.
Usually they ask us beforehand or they'll do it themselves. They'll see the sheet, and if
Mhm,
it says I have a pacemaker, the hopefully the patient knows the model, like the type of pacemaker, and then there's a book
mhm,
like to look to see if this is it MR compatible, which means there are no issues. You can go get the scan. Is
mhm,
it functional, which means that it works with certain scanners, certain strengths, whatever,
mhm,
or is it not compatible at all? If it's not compatible at all, then unfortunately you're done, and
mhm.
that's when they'll call us and be like, what test should we do now?
Right.
So once you do that, everybody with metal makes it to the second to zone 2. Once you get checked through zone 2 by the tech, they've cleared your pacemaker, they've cleared everything. Then you go to zone 3, which is the MR suite itself. So that's where the control room is, like where the techs do their thing. That's what zone 3.
Mhm,
And they don't have any metal on them. Like they can't have their badges can't have metal. Nothing can have metal. So once you make it to zone 3, you can't have metal. And then zone 4 is the actual magnet itself. So the
mhm,
zone 4 is just the magnet. So those are the 4 zones, but the biggest one is zone 2, I think, because you
mhm.
can't go past zone 2 with any like, the whole point of zone 2 is to check to make sure you don't have metal, so you prevent a gunshot like this guy. So once you get to zone 3, the tech will, you put your gown on in zone 2, you go to zone 3, that's when the
Mhm,
tech will then put you in the scanner, which is zone 4, but they do all of their work out in zone 3. So once you get to there, you should be good to go, right?
mhm.
If you have metal, they're going to find out. Like this guy that brought a gun in and was like
Yeah.
it went off. So, and I mentioned earlier that the magnet can the field will extend past the room. So there's actually what they call a 5G line, which is to the point where if you walk past it, it can affect any metal you have in your body, right? So if
Mm.
you tell them you somehow they make it past without a pacemaker, like without
Mhm.
knowing that they if you walk past the 5G line, it will affect your pacemaker, and you're not even in the scanner yet. So that's why it's a huge issue. And if it affects the pacemaker, I mean, what happens? They're going to die, right? If the
Yeah.
pacemaker shuts off, they go into arrhythmia, whatever. So that's
Mhm.
why it's a huge issue with knowing if these people have metal.
Right.
I remember, and I think this is a concept that a lot of patients don't really understand. We had a
Mhm.
patient one time that had I think like some kind of congenital heart defect, and they had it fixed, and they were like 2, and we're like, well, can you get records? Because I think it was a she, whatever. They were older, so it was a long
Mhm.
time ago. So we're like, MRI was fairly new, so this thing may not be MR compatible. But
Right.
you're like trying to explain to them that if you have metal, the magnet can move it, right? It can move the magnet, or it can move the metal in your body. It can heat
Mhm.
it up.
Mhm.
It can do a whole bunch of stuff. And yours is in the heart. So if it
Mhm.
heats up, it will sear through. If it's in a vessel, it's going to go through the vessel, and you're going to bleed to death before you even know what happens.
Right.
If it moves it, it's going to rip the vessel. Same thing. And they just get pissed because they're like, they just don't understand. And I'm like, if you want to sign a waiver that says you get in this magnet and you could die, go for it. But unfortunately, that's not how it works.
Right.
So it's a huge deal. And then it's another big deal because another thing, I'm sure you've never even heard of it, but most people have never heard of is when you have to quench the MRI, which
Mhm.
is so essentially the magnet is on 24/7. They never turn the magnet off. And if you have to quench it, quenching is essentially turning the magnet off. But it's a
Mhm.
huge deal. It's
Yeah.
very expensive.
Mhm.
So this is where it gets kind of a little nerdy. I'll be frank with you. But do you know how the MRI magnet? We said burns were the most common thing. Do you know how they cool the magnet?
I don't know. I've heard of quenching. I
Hmm.
don't know how they cool a
So
magnet.
it's constantly being bathed in like liquid helium. So liquid
Mhm.
helium is what cools the magnet or the coils to keep it
Mhm.
from overheating. So if you quench something, quench that magnet,
Mhm.
what happens is the coils essentially get super fucking hot, super hot, so hot that it turns the liquid helium into gas. So gaseous helium. So then what happens is they have like a what's the word? A vent or something, some kind of conduction system where it will
Mhm.
take the helium outside, right? So
Mhm.
that's the whole point is
Mhm.
to get rid of the helium.
Yeah.
So the coils will overheat, turn the liquid into gas, and then the ventilation system, that's the word I was looking for, is supposed to take it out of the room.
Hmm.
but that doesn't always work. So sometimes what happens is when it turns the liquid into gas, the gas will displace the oxygen. So if you're in that room and helium turns into gas, you can suffocate to death.
Yeah.
So that's what they always recommend. If you have to quench, you have to leave. Everyone has to leave immediately.
Hmm.
And you're not supposed to close the door because the pressure of the liquid helium will keep the door shut. So you can't even open the door. So if someone gets trapped in there when the door's shut and there's gaseous helium, they're dead, right? Because most MR suites you've seen they have like a glass between the scanner and the tech.
Hmm.
So to equal out the pressure, you'd have to break through that glass, and then the helium would escape. So
At least they have the glass. I mean, I guess
yeah,
it's
it's a
probably
huge deal.
yeah.
There are there's like the MR tech and the doctor are like they have to discuss like if quenching is necessary. There's only two scenarios that they teach us where quenching is like 100% necessary. Do you know what they are? Just by
Uh,
chance.
I'm guessing that it's like a patient or something is in there or something.
Yeah, so
Maybe.
one of them is if either the staff or the patient gets trapped,
Yeah.
right? So something gets sucked into the scanner and they're
Right.
trapped between the scanner and whatever gets sucked in the room. The other one is a fire. If there's a fire, because if that helium gets lit on fire, it's
Yeah. It's
toast, you
over.
know.
It's over. Yeah.
So those are the two. It's crazy because even if someone codes in the MR scanner, you don't quench the scanner. You
Right.
get them out of the scanner as quickly, and then you do the code in zone 3.
Yeah.
So it's a huge deal. It's very expensive because then you have to replace that helium to use the
It's
scanner again.
probably what, like
So
$1 million or something. Right?
it's very expensive.
Yeah.
So then you have hospital administration pissed off at you, you know, because
Hmm. It's a big call. Yeah.
usually they're not pissed off at us, right? Because it's the patient that lied. Like in the case of the gun,
Hmm.
I know the tech asked, "Hey, do you have any metal?" And the dude
Hmm.
just outright lied. So
Yeah.
it's his fault. But
I wonder if there's should they have used like a you have to go through a metal detector
yeah,
prior.
they have a metal detector.
They have a
So
metal
that's how
detector.
they call it a wand, and it's not as strong as the MR magnet, but it's what we use if you have people that tell you they have metal somewhere in their body. Because a lot of times people will get X-rays, and you're like, I can't fucking tell you if this is
Hmm.
magnetic or not based off an X-ray.
Yeah.
So they'll run the wand over it, and if it reacts to the wand, whether it heats up or moves, or like sometimes you can see it stretch the skin, like you can see it want to start. And if it reacts to that wand, you don't put them in the scanner because the scanner will rip it out.
Hmm.
So they do have a metal. It's not a
I've heard
metal.
of like people with like retainers, like they have permanent like metal
Hmm
retainers, and they'll go in the magnet.
hmm And I'll
And
ruin the image. Yeah.
I don't know if it's just is it just the retainers are so small that it doesn't pull? I mean, because obviously,
Likely they're not magnetic. So they have to be things have to be what's called ferromagnetic. So not just magnetic in general.
okay.
Likely the retainers aren't ferromagnetic. They're just metal that it would might react to like a normal magnet, but it won't react to the MR scanner. But
Mm,
in that case, the retainers ruin the image, right? Because you can see it just a blur across the whole face because they have metal in their mouth.
right.
But it's a huge deal. The whole point of this segment was to say that if the fucking tech tells you, hey,
Mm,
do you have metal on you? Like this is life and it's truly
yeah,
life and death.
right.
We mentioned the one guy that killed himself with a gun. I
Hmm.
mentioned the funny one, not funny, but you know the
Hmm.
had a it was a sex toy, and the
Oh yeah.
packaging said there's no metal in it. So he's like,
Mm,
oh, I don't know. One, I don't know why you wear it to a
yeah.
MR scan to begin with. Fucking
Right.
that's stupid.
Yeah.
But the box said no metal, so I'm assuming he didn't tell them,
Hmm.
or he or she, whatever, didn't tell them,
Yeah.
and got in the scanner, and turns out there was metal in that thing,
Hmm.
and it won't respect boundaries. It destroyed his. I mean, through the colon, through the abdomen, everything. It will destroy you.
Inside. Yeah.
So
Yeah. Yeah.
it's
It's not something
just
you mess with.
stupid. People are just. It's like not. It's truly not a suggestion. Like if
Yeah.
you want to die, take metal into the. And then
Right.
I don't even know how it works legally. If you're the reason that we have to quench the scanner, or then you at fault and you have to pay for something. Like I don't know how that works.
Right.
But
Right.
the bottom
Yeah.
line is just if you have metal anywhere, tell
Hmm.
them.
Right. Yeah. I
So.
mean, I think they show whenever you like a new employee or something, they show you like the magnet's always on,
hmm
different instances where they've taken um, wheelchairs or
Yeah.
stretchers in there, and they didn't take MRI safe ones, and they just pulled it right into the magnet, and then they
Hmm.
had to quench the magnet and turn it off so they can get the thing out of there.
Yeah,
And
because if you don't, you're not getting that thing out. If you don't, you're not going to be able to pull it away.
right, and the stronger the larger the object, the
Yeah,
stronger the pull. you
yeah.
know
I
and
mean,
so
people like legitimately have died because they get trapped between
objects, yeah,
the gurney or whatever gets sucked in, and you get like you're gonna die.
yeah.
It can suffocate you, do whatever. Maybe it causes fractures, whatever. Like there's a whole bunch
Mhm.
of shit that can happen.
Yeah, I,
So
I think I saw, like, I think it was like, like 60,000, 100,000 times stronger than gravitational pull of the
there
Earth.
you go.
Like, it's
See,
just
that's crazy, isn't it?
like, it's like
Crazy.
that's nuts. And what's crazy is that how many like MRI machines that we have all over the world, all over
Hmm.
and so we have these things that are that powerful all
Yep.
over the place.
And
Uh,
it's like I said, it extends outside of the room, which means up, out, so it can extend up to the floor above. So if your MR scanner's on the first floor, the field will extend to the second floor. So you can't have anything metal right above it, or it will. I mean,
yeah,
it'll just suck it down to the floor. But if it sucks it through the floor, that's a different story.
right,
So
man. Yeah, that's crazy. I didn't
I
think
think it's
about.
just an aspect people don't like. I don't know if they just think we're telling you this for the fuck of it, but like this is
Mm,
real life that
mm,
scenarios have happened that were 100% preventable.
yeah, I don't even think that, and I didn't realize. Like, I knew the different zones, but I didn't realize that how far it extends.
Hmm.
If it extends, how if it's on the first floor, how far on the second floor does it extend, or does it?
Yeah, I mean, it'll depend on how strong the magnet is. If it's a
Right.
1.5 or a 3, I mean, some of these academic places have seven Tesla magnets.
Yeah,
So
yeah, that's
it's
what
crazy.
I was seeing. It said a 3T MRI scanner is around 60,000 times stronger than the entire Earth's magnetic field.
There you go. 60,000,
And
which means a 7T is double that, more than double that. So, and they're working, I think they're working on like 10T scanners. There's just so many issues that can happen. I mean, we talked about burns. I don't know if you ever had an MRI, but the coils are what
Mhm.
make the gradient coils are what make the loud clicking noise. People have issues with hearing issues after that. Like, so, I mean, we talked the last episode about someone doing the full body MR and saying there was no radiation. Sure, there's no radiation. That's
Mhm.
100% true. But there are other
Yeah.
issues,
Mhm.
and
Safety concern.
radiation may kill you when you're 85. That
Right.
MR magnet can kill you now.
Right.
So
Yeah, it's a
just
scary thing. It's important to, yeah, you listen to
yeah, I
these
mean,
healthcare
it's
folks, man.
crazy. No
Yeah.
radiation doesn't mean it's 100% safe. So I just
Right.
thought this. I don't. We usually don't get this technical on the podcast, but I feel like it was an issue that we need to talk about because
Yeah.
I
Yeah.
feel like a lot of times don't take it seriously.
Right. Well, and
So
in other aspects of radiology, the X-ray, ultrasound is myself, and
hmm
X-ray or whatever, like, we're not as familiar with all these MRI
hmm
different things. We go in the top of the barrel baseline
yeah.
details of
I
there's
mean,
four.
did they even check you? Like, I'm assuming you've taken a patient from ultrasound to MRI. Do
Mhm.
they check you? Because you go into maybe go into zone 3 if you take the patient straight there. If not, then you're at zone 2 and they don't need to check you. Have you ever been inside the suite with a patient?
No, the farthest
Yeah.
I've ever gone with a patient is zone
So
2.
you work in the hospital, and even you're not allowed in zone 3. The tech would have to. The only
Yeah.
people that are allowed in zone 3 are the techs and us,
Right.
unless you've been checked. Like if the tech checks you, no matter what, then you can go. But you have to be zone 2. I think is the most important because that's where you have to be screened. So if someone happens to waddle in through zone 2 without being screened, that's when shit can happen.
Right.
But
And I and I and I think there's tests too, like, you have to take the MRI test just to be able to, yeah, like you said,
mhm,
to be checked or whatever, like, I have to be
yeah,
signed off that I'm able to
hmm
go around MRI, um, which
it's
is, yeah.
crazy.
Yeah, it is.
And
I've had an MRI before. I've been an MRI.
the loud, a lot of
Yeah, the
I
lab.
think we could get into an aside, but a lot of people think they're claustrophobic when they get an MR. And I'm like,
Yeah.
this made me
Yeah.
think. You don't watch Rick and Morty, but it made me think of his name's Mr. Poopy Butthole. I'm gonna put the clip in here when I put this on YouTube. He's
Right.
like, oh, claustrophobic. I mean, people, you're not claustrophobic. Like you can literally, it's a tube, but you can
Yeah.
see each end. You can see out each end.
Mhm.
To me, claustrophobic is like
Yeah.
I can only see the out behind me, but going forward, I can't. It's just dark. I can't see shit.
Right.
So when people say they're claustrophobic, or they want Valium or Xanax to get. I'm like, Jesus Christ, guys, like
Mhm.
just get in the scanner.
Yeah,
So now, and we've talked about this a little bit. People that are claustrophobic have to get in the open scanner,
mhm,
which degrades the images.
mhm,
I had one the other day, and he had a knee, like a partial knee replacement, and he
mhm.
was claustrophobic and couldn't get in. And I was like, "Can we put him in the closed?" She's like, "No, he's claustrophobic," and it ruined the MR. He couldn't. He essentially got 3 or 4 sequences, and I said, "This is non-diagnostic."
Mhm. Yep.
So like, it's again, we're not like trying to shove you in the scanner
Yeah.
against your will, but like those closed scanners are so much better than the open,
Mhm.
so much better. I don't know what the equivalent is in ultrasound, but
Yeah.
as far as image quality, but
And does that affect the T's, like the, 1T, 2T, 3T? Is it like, you know, more a closed one would be a higher T level, or
no, they can
is
all
it just
be.
a core?
It just
Oh,
affects the. We're gonna get nerdy again, but it's essentially the closed is uniform, right? Since it's closed, the
mhm.
signal is uniform throughout the whole thing, so your
Makes
picture
sense.
is much better. When you get in the open, it's obviously not uniform because part of it's open. But
Right.
the strength, I think open magnets usually are not as strong, but
Mhm,
they can be 1.5. They can be both open and closed, but
mhm,
it's more about like the picture, like how
mhm.
good the picture looks, which you guys don't care about, but we do on the back
Yeah,
end reading it. So,
that's your
and then
thing.
it gets into another issues because most research is done on the closed. So if you have stents and they say, oh, it's approved on the 3T closed scanner,
Mhm.
you can't just plop them over to a 1.5 open and say, oh yeah, the stents are fine. So, which techs try to do sometimes, and you're like, no, the studies were done on the closed 1.5, not the open 1.5. So maybe they'll be fine. Likely they'll be fine, but you want to take the risk and have them have that stent move or sear through the vessel and kill the patient? I don't think so. You know.
Yeah, for real.
So,
Huh.
but I know that what are some of the equivalents in ultrasound? It's not life or death, but there are
Yeah,
definitely things you guys tell them to do that they don't do that then
right.
affects the images or whatever.
Which I just had this with a patient the other day. When we tell people, don't eat anything before an
Mhm,
exam, that's super important. If we're looking for your gallbladder,
mhm.
you have a fatty meal and your gallbladder, you eat a BLT or something, your gallbladder
Yeah,
contracts. And so we're like, okay, which we don't see through gas in ultrasound. And so if we
yeah,
cause a bunch of gas, I also did a simple aorta exam as a screening exam,
mhm,
and I wasn't able to. I was like, okay, well, he's like, oh, I just ate breakfast. And I was like, well, you're not really supposed to.
yeah,
Let's try to take a look and see what I can see. And I took a look and I was just like, I don't think these images are going to be diagnostic enough. And it could just be, you just sometimes you just get a big person and they're just naturally
yeah,
gassy, or is it the
yeah,
food? And it's like if I'm not sure one way or the other, I'd rather reschedule you. And it
yeah.
sucks to reschedule. But I think a lot of times, and I don't know, I have so many patients that have told me, um, they don't get told by their doctor's office that they should be NPO,
Which it may be
or
true, the doctor's off, which I think is an issue. We should be the ones that tell them. But I mean,
yeah,
that's another issue. Things fall through
mhm,
the crack or whatever. But
right.
I can believe that there's sometimes I do a lot of procedures, just basic procedures, and the patient comes in and they have no clue what's about to happen. And I'm
Mhm,
like, man, the doctor that ordered this should have at least prepped you. Like, you have no idea you're about to get a needle in your shoulder and I'm
yeah,
gonna inject contrast. Pretty straightforward, but
right. And
so I
and I
can believe that part.
and I think, yeah, I definitely think we should be the one, as a hospital, we should be the one to tell them. But it would be really beneficial too if, like, the doctor gave them a piece of paper or something and says, like, this is what's going to your
Hmm.
procedure, like a generalized understanding of like
Yeah,
what's going to happen. What, don't have anything to eat or drink for 8 hours or
yeah.
whatever it is. And so you don't come in there and you're just like, well, I don't even know. Like, no one told me. You're like, somebody along the line
Somebody
should have
told
told
you. Yeah, yeah,
me.
yeah.
And then it sucks because then, well, and also, I think we're so backed up with exams
Hmm.
that we're scheduling people out sometimes like a month,
Yeah.
2 months in advance. And so they're like, I don't know, I booked this like 3 months ago. And
Now you
so,
know how Canada feels.
yeah,
Socialized medicine.
socialized medicine. Shout out to all of, we're the only
Shout
country in
out
the
to
Western
Canada.
Hemisphere without socialized medicine, I believe. Um,
But yeah, I mean, it's a huge issue. And
mhm,
then they get pissed at you because, oh, nobody told me not to eat. Now you can't. And you're like, well, I can't see your gallbladder because
yeah,
all the fluid that was in there, you have now just ejected because you ate. Or I
right.
told you to come with a full bladder for your um, oh,
Kidneys or
renal kidney. Yeah,
yeah,
you
yeah.
you voided right before you got here. Come
Mhm.
on. So I know
Yeah.
someone told you at some point. So yeah, I
Mhm.
agree. It would be nice if there was like a printout that said "Don't eat." Here's why you don't eat. Even
Right.
you can go that far, but
Mhm.
give them a YouTube video or something. Jesus,
Yeah.
something.
It'd be a great thing. Yeah, maybe that's something that we'll get into. We'll make YouTube videos and they'll just send them our videos of what we just
Here's why
explained.
you don't. Yeah,
Here's why you don't. And
yeah,
it's, shoot them an email. I think that would be a great thing if you don't want to waste paper or whatever. You're like, okay, check your email and we're going to send you exactly
yeah.
like what you need to do beforehand.
Or if they're boomers, somebody can call and be like, "Here, here's
Right.
why you don't." I feel
or,
like it's somebody,
or
and
if
then
you,
they get pissed at you because you're like, "Nobody told me," so now you're like, "Oh, we have to reschedule," and they're like, "Oh,
mhm,
that's bullshit. Just do it." And you're like, "Well, I could
yeah,
do it, but it's not going to show you what we need to show." And then I'm
mhm,
going to be like, "Well, it doesn't show me what I need to show. Repeat the
right.
fuck either repeat it or
Yeah.
whatever." So
And if it's pre-boomers, then we'll just like whatever that, we'll send somebody to your house
Gen
and just
X is
and just just talk to
pre-boomers.
you
Yeah,
and just have a, knock on your door, ring your doorbell and
yeah.
come inside and
That's maybe not today's day and age. People might get killed.
yeah, don't
You
do
know,
that.
especially in the
I
Midwest or the South or something.
yeah, I
There's gonna be
I
some guns pulled on that. So let's,
I think I
for
think,
legal purposes, that was a joke.
it's a joke. I think,
But
I think I've had good, rapport with folks though too, and I'm like, "I'm sorry that no one told you or, the right people didn't tell you, and but if I do this exam, it's gonna be non-diagnostic and
yeah,
or not as diagnosticable as if that's a word, that"
I don't think it is, but we'll go
yeah,
with it.
probably not, but, like, you're not gonna get as good of results possibly.
Just tell them you're gonna save them money because like we may have
Yeah,
to repeat the
redo it.
exam. Insurance is gonna cover it. Just tell them you'll save
Yeah.
money. They'll be like, okay, fine, whatever.
Yeah, this is true.
But
Yeah, um,
all right,
cool.
25. We got 26 minutes out of that one. I
How's it?
was I was passionate about MRI safety, so you're welcome.
Well, I mean, if you're going over it right now, it's fresh in your
Yeah,
mind, so it's a good thing
yeah,
to
I'll get
talk
tested on it. I'm pissed that I have to learn it, but
about. But you've got to
yeah,
somebody's got to know it. Somebody's
yeah,
got to be in there ready to quench that thing if we have to.
yeah, yeah. I'll take the blame. But all right, what's next? What do we got? Oh, we got a good one next. This one
Right.
was I've bitched about this group all the time. I don't know why I'm still in it, but I saw something in the ultrasound group on Facebook, and one of them was complaining about, I forget if it was a specific study, but the overall theme was like coming in at night, overnight, to do quote unquote stat exams.
Mhm.
So there was two themes you can imagine. One was like, yeah, we should, and one was like, no, we shouldn't. But you and I are going to be on opposite sides, which I think is why
Mhm.
it's a good thing for us to talk about. So I want you to explain the
Yeah.
ultrasound side of things about coming in for
Yeah.
stat exams overnight.
Right. And so in a lot of hospitals, they don't have overnight coverage, and so they'll have somebody
Hmm.
on emergent call just with
Yep.
the staff. I mean, staffing issues. This has been around forever, not just recent.
Yeah.
With staffing issues. And so, because we don't have anybody there on emergency, we need somebody to rule out a torsion case or a DVT study or a gallbladder study or whatever,
Yeah.
cholecystitis, whatever the problem is. And so these uh, ER physicians will order right upper quadrant to rule out gallbladder because they're having gallbladder or cholecystitis
Hmm.
because they're having gallbladder issues.
Hmm.
And a lot of these things, a lot of some, and what I think it boils down to is sonographers feel like they're being abused because you're calling us in for different studies that maybe it could have waited till the morning, or
Hmm.
maybe they could have had a CAT scan instead. Not
Hmm.
saying that's the radiation in these little in instead of and so they're burning out your staff that we don't even have a midnight staff person for anyways because maybe we
Yeah.
can't hire a midnight staff and now you're burning out your day shift staff. We're
Yeah.
coming in, we're doing this gallbladder or DVT study, and then we're also expected to be in the morning at 7 a.m. or 8 a.m. and
Hmm.
work the full day. So you have us coming in at 2 3 sometimes. I mean, there's been nights where I was called in so many times and then I had to be in at 8 in the morning and you just feel like you're just a zombie.
Yeah.
Like, I mean, the level of care, like you're not taking care of yourself. So the level of care you can give your patients is not optimum.
Yeah. Yeah.
And so now I'm like risking missing things because I'm so tired because I was doing patients all night long.
Yeah.
Um, And so that was and then, I'm like, oh, then somebody sees a job opening somewhere else, they're going to take that and get it. If I can not take call, or if I can
Yeah.
not take, whatever it is, like, because call is just a huge issue. But I was talking to Gage, and he said, what makes you think that, like, and then I've worked at hospitals as well, that with to help minimize call, they reduced what the physicians or the providers could order. And
Mhm.
so they said, okay, you can't order gallbladders anymore. You can't
Mhm.
order DVT studies anymore. And so what they would do is they would hold the patients,
Mhm.
and they would either do the gallbladder study in the morning if you didn't, if you didn't get the CAT scan, or
Yeah.
they would do the DVT study in the morning. But if they really thought they had a blood clot, they would treat them with blood thinners.
Yeah.
And so, but Gage is like, that
Yeah,
that.
so when you mentioned that, there were 2 options. The
Mhm.
DVT one specifically, the CAT scan or the gallbladder one, whatever, get the CAT scan, I guess, and
Yeah.
then we can pawn it off on nuclear medicine, if we wanna get a HIDA scan. But the
Mhm.
DVT one specifically, I told you there were 2 options,
Mhm.
right? So the ED physician or whoever suspects they have a DVT, very high clinical
Mhm.
suspicion,
Uh-huh.
and you guys are like, "No, I'm not fucking coming in to do this stupid fucking study." So
Mhm.
the physician's forced to be like, "Okay, I have to start you on a blood thinner."
Mhm.
Because I think you have a DVT.
Right.
Okay, so there's one option. You don't do the scan, they start them on a blood thinner. The
Mhm.
other option is it's kind of a low suspicion. They don't start them on a blood thinner. You
Right.
guys do the scan in the morning. So both outcomes likely are going to be fine, right? Nothing is
Mhm.
going to happen. But so the adverse outcome for scenario one is that
Mhm.
they start them on a blood thinner. You guys do the exam in the morning. There's no clot.
Mhm.
Maybe there was never a clot. Maybe it's dissolved by the time you guys do the exam. So the
Mhm.
issue with I've told you I've seen this in practice. You
Mhm.
don't want to start people on blood thinners unnecessarily because they can cause spontaneous bleeds.
Mhm.
And I've seen people spontaneously bleed in the brain and they died.
Yeah.
So now that's a scenario that you guys I mean you don't have to take any like legal action. Like you're not responsible, but like
Right.
if you're a good like a decent human being, you're going to take responsibility for that because you're like, well shit. I should have
Mhm.
just come in at 3 a.m., done
Yeah.
the exam. And then the negative outcome for scenario two is there is a clot, even though it's low suspicion, there is a clot,
Mhm.
and it progresses to a pulmonary embolism, and the patient dies.
Mhm.
I get those are extreme examples, but those are like it's kind of how you have to think. So I
Right.
told you those were the two options
Yeah.
for DVT specifically that I don't think a lot of people tech specifically think about.
Yeah. I think in this instance, it's super important. If you just have if you're calling me in for a DVT study because they have just elevated D dimer, I mean,
Hmm.
D dimer it means a lot of different things.
Hmm.
And so I've done patients like that before, and just like, so you don't really have any leg pain, you just have an elevated D
Hmm.
dimer, and that's what I'm here for. I'm like clinically, I think, and I think as other sonographers, we're like, okay, are you not doing your due diligence clinically before you're calling me in at 3 a.m.,
Hmm.
knowing I have to be back here at 7 a.m. And when you call me, I have a half an hour to be there. Like, I know a lot of hospitals use a half an hour, some use 45 minutes. I've never
Yeah.
worked at a place that's used, I don't think, an hour before. But so I'm like, when you call me in, I have to be up, changed, ready at the hospital within 30 minutes.
Yeah. Just
And
sleep in your
so,
scrubs.
yeah, I mean, sometimes, I mean, there was nights, yeah, legitimately, there was nights that I got called in so many times, like 3 or 4. I mean, if you start call at 7 p.m. and you work till on call till 7 a.m. when you come in the next morning, if you get called in a couple times, sometimes you just lay down. I mean, that's why we're gonna have a talk. Have you ever slept at the hospital? And it was like
Yeah.
sometimes I like you're there at 6 a.m. and you're like, well, I can't go home, but I can't clock in yet. And so what do I do? You just like fall asleep
Take a
in a
little cat
chair
nap.
or something.
Yeah.
Yeah, like you just you hang out, and so and that as management side, you don't want to burn out your staff you have. You
Hmm.
don't have enough staff to staff that midnight position,
Hmm.
or no one wants it. No one
For sure, nobody wants it.
no one wants to, but then again, no one wants to take call for it either.
Yeah.
And so you're just like this double-edged sword. What do? You want to take proper care of your patients. Like the patients is a frontline staffer. Like our job is to take care of our patients. Our management's job is to take care of us.
Hmm.
And so I think that's where the conundrum comes. And I've worked at a facilities where they've drawn different lines, and so okay, you can't be called in for a gallbladder.
Hmm.
Okay, you can't be called. Another hospital was you can't be called in for anything but torsion. If it's
Hmm.
testicular torsion of ovarian torsion, you can't be called in for that. But then there's other places that like, they call you in for like a breast abscess or something that
Yeah.
probably could wait a couple hours.
Hmm.
That hasn't just accrued over this short period of time or something. Or,
Hmm.
or you've gotten called in for, I've been, and I think, and this is where some of the frustrations I think come from, is a sonographer that's been called in. This person started having pain in their belly a week ago,
Yeah.
and they were
Yeah.
like, "You know what? Tonight's the night. I'm gonna go to the I'm gonna go to the ER." And they
Yeah.
say, "Well, we're worried about cholecystitis." There's like, "Well, you've had this pain for a week now. Like, you can't wait another 3 hours for us to." And maybe, and you know better than me, how
Yeah.
things can go south for folks if they have. But I mean, if you truly see, somebody's jaundice and like you really think they have cholecystitis, there's a CAT scan that you can do, or
Yeah.
treat the symptoms. Treat
I
what
mean,
you.
surgeons, we dogged on them a little bit last time, but they're usually pretty good clinically.
Mhm.
Like if they think this person has cholecystitis, they're gonna say fuck the ultrasound. Like we're the clinical symptoms are enough for us to like, because cholecystitis specifically, it's a laparoscopic, so that
Mhm.
they don't there's no huge incision, so they're like
Yeah.
clinically it fits, so let's just do it. So I feel like in that scenario, the surgeons would be like, I don't need the ultrasound, I'll just take him and take the
Which is
gallbladder
just
out.
which has just made me think about something I did. There was a At a certain hospital I worked at, they didn't do vascular exams on the weekend, and so during the week they would do various arterial studies, venous studies,
Yeah,
but on the weekends, um, they didn't do arterial studies, or whatever it was.
yeah. They
And I
didn't
remember,
DVT studies either.
I think that they would just do, it was like strictly
Oh, okay,
DVT. They
good.
wouldn't do like
Yeah,
a carotid, or they
yeah,
wouldn't
okay,
do
yeah,
a
that makes sense.
um, lower extremity
Yeah,
arterial.
I get you
And
now.
so,
Okay.
and I remember having a conversation. There was a provider that called, I think it was a nurse practitioner, that called and said, I need this lower extremity arterial study done. There's no flow in their legs, are cold.
What?
A- and I was like, well, we don't do like,
You need a vascular surgeon.
yeah, well, and that was such a, and this goes back to, I think, the clinical frustrations, is you go back to, and I remember telling her like, well, we don't do arterial studies. And we're like, well, it's a cold leg, like it needed done, like.
Yeah,
And if you're thinking in your mind, you're like, well, if we don't do it and the leg is cold, like, what are you waiting for?
yeah.
Like, why are you even waiting for the ultrasound?
That's not even the study she should have. At that point, you need to see the surgeon that wants a CTA, first of all, not an
Yeah,
ultrasound.
yeah,
Secondly, you should have called the surgeon first.
mhm,
Then they said, "Hey, maybe I
yeah.
don't need to study it. Let's go now.
That's yeah, that,
If
yeah,
this leg is cold."
yeah. If you're having, if
So
that's a real issue, like clinically, you're like this, and this.
yeah,
Like, let's, like, we're wasting time.
this kind of gets back to our point about I don't know, last episode whenever we talked about we wish we could educate people
Hmm.
on like what they need to order, when they need to
Right.
order it. Feel very strongly in fellowship. I obviously did MSK, so all
Hmm.
of our studies came from ortho. So I
Hmm.
feel very strongly that all MSK MRI should come from ortho, unless it's for osteomyelitis. Anybody can order that. So I
Hmm.
feel very strongly that the person that's going to handle it should be the one that orders it. In this scenario, the vascular surgeon should have been the one that said, because you would have listened
Hmm.
more closely if
For
a
sure.
attending vascular surgeon says, "Hey, I need you to do this."
Hmm.
Secondly, she would have said, "I'll just get the CTA. I don't need the ultrasound."
Hmm.
So I feel very strongly that the specialized physician should be the one ordering the specialized imaging. It's not like a chest X-ray. Oh, I have a cough. Anybody can order that, fine. But when you
Hmm.
get into this highly specialized stuff,
Hmm.
we're specialized in reading it. Not all of us read all of this stuff.
Right.
So if we can't read it, and not all of us can read it, not all of the providers should be ordering it. That's
Yeah.
a little aside, but I feel very strongly that specialized physicians should be ordering the specialized studies.
Right. And
So
I think with this particular case, I think they ended up like shipping them out. And
yeah,
so you were like what were like, okay, if it would have, what, just thinking things through, if you would have came to me and I would have done it, and I'd be like, yeah, there's no blood flow, like there's nothing there.
It's like that meme. You remember where he's
Yeah.
like, I don't think I have the facilities for that big man. It's like you're gonna order the exam and you can't the surgeon can't
Yeah, ain't
I
nobody
read
here to
a
do it.
I
We're
read
gonna
a
order it and then ship them
yeah,
out.
I read
You're like, what?
a brain bleed the other day, and I'm like, this person needs to see neurosurgery now.
Mhm.
She's like, oh, we don't have that. And I'm like, well, you better get them somewhere that does,
Yeah,
like now.
exactly. It's
So
like,
if you don't have one, you shouldn't be ordering it. Two, if you don't have the facilities,
Mhm.
that if you do order, say it is the right study, and you don't have a vascular surgeon, what the fuck are you doing?
This is
I
true.
mean, you've heard the saying, time is tissue. That's for everything. So
Mhm,
if you're not a specialized stroke center and we tell you this person has a stroke, they need to be gone. Like as soon as
mm,
I hang up the phone with you, they need to be gone.
yep,
Heart attack, this is the same thing. They needed to revascularize that leg as soon as possible for any
mm,
chance to not
right.
amputate it. So the fact that you're dicking around trying to call the ultrasound tech in for I mean, we're getting off on a tangent, but there's,
Well,
I mean, there's reasons why we do things the way we do them, you know?
right, and I think that, yeah, and folks who are listening to this, maybe if you're not a medical person, but, like, a lot of hospitals, sometimes they don't have the surgeon there, or they don't
Mhm,
have certain, like Gage said, certain facilities have certain
mhm,
things, or they do certain things better than other facilities. They have certain people, they have more people, whatever that is. And so
mhm.
maybe you're in a, I've worked in, you have a little hot local hospital in your town that doesn't have something, that they ship them off to a bigger
Yeah,
city or a bigger town or some place that has it. So it's not like it's not like Walmart where you go and it's just they have
yeah.
everything
It's not
there.
one-stop shopping, yeah.
Yeah,
I
it's
mean,
like
they might be able to handle grandma's hip fracture, but that doesn't mean they can handle her brain bleed. Like,
exactly
there's levels to everything. So,
right.
I think it's good to, even if you're not medical, to I mean, we're making a joke and, like, shitting on these people, but, like, what we're
Mhm,
saying is real.
mhm,
So, if you are listening and you're a patient or you're, um, a spouse or somebody of a patient,
mhm,
you can at least ask, like, "Hey,
mhm.
if this vascular study comes back positive, do you have the
The
surgeon or
capability.
whoever? Maybe it's
Yeah,
IR that does it there, somebody that does the vascular stuff there." And if they
right.
say no, then you can be like, at least like, hey, then,
Mhm.
can we get on the phone with the hospital that will take care of this?
And I think another even a good aside is pediatric. If
Hmm.
you have kids,
Peds is a
and
whole different, god
it's a
damn.
whole nother world. And so I think if you have kids, I think that's important to know, where's the nearest pediatric hospital, or
Yeah,
where's the
that's where
nearest,
you should go.
that's yeah, the people, yeah, the facilities that are used to working with kids, or pediatric hospital. Like if you have kids, like I think that's something that should be on your list of, like, how far away is the nearest pediatric hospital?
Because
Just
I
something
give
that
you
you should
insider
know.
information that there is not a single population that doctors are scared to work with more unless they're trained with it than kids.
Right.
If you
Yeah.
don't work with kids all the time, you doctors don't want to. I don't want. I'm in that boat. I don't want to touch peds
Mhm.
imaging. I don't want to touch it.
Yeah.
It's not like they're little adults. They're truly their own. They have unique diagnoses, unique diseases.
Mhm.
Everything's different.
Yeah.
So yeah, it's definitely good to know like
Right.
where
Yeah.
you're. If it's like a common cold, fine, go see a general doctor, whatever. But if you
Mhm.
start to get a little more serious, then yeah, I agree. You need to see where the nearest kids hospital, children hospital is.
Yeah, things located in different places and
Yeah.
bodies still grow. Yeah, it's completely different. Yeah, I mean,
Yeah, I mean, for imaging, things look different in kids. I mean, the
mm,
easy example is growth plates. Adults don't have growth plates, right? Because they're
mm,
closed. Kids are
mhm,
still growing, so they're still open. So even the imaging, just imaging alone, not counting all the other stuff, is
mhm,
vastly different in kids. What they can, so if you see a tumor in the kidney in a kid, it's a completely different diagnosis than it is if you see it in an adult, and
mhm,
it's much more serious in a kid than it is an adult.
mhm.
So you want people that are like specialized in kids. So,
Definitely, definitely.
but somehow, goddamn, fucking man, 45 minutes.
Somehow we did it again every time. We have like two topics. We're like, we need to have another topic, but I think we
I
can
was just so
probably
passionate about MR safety that I did not expect it to take 20
so
minutes. So,
passionate about MR safety. Well, it's all important. So I
yeah,
mean,
it is.
especially when
Yeah,
it's fresh in your mind, like it's nice to go over these things that you're like getting ready to take a test
yeah.
on, that, like super knowledgeable.
And I can tell the people that I got tested on it, right? So
Yeah, then you can maybe go on
I'm
the
not just
MRI.
making this shit up.
Yeah, just making this stuff
I have to
up.
get. I'll have questions about this the next end of the month. So
Yeah, next week on, I'm just making this thing up.
yeah,
No,
I mean, I think a lot of people think doctors just make shit up,
yeah,
but I'm not.
no,
I'm not
yeah,
making this
yeah.
up. This is real. So
Especially with the, I won't go into it, but especially on like Googling things, the amount of education
oh,
that
I
you
get
guys have
pissed.
had
Yeah, we've
versus
briefly
like,
talked about this. I get
yeah,
so
yeah,
pissed.
yeah.
This will be my one, two, three, like fifth certifying exam, like board exam. Come on, like
Yeah.
I get it if you've lived with the disease for 20 years and
Mhm,
I've just had lectures on it, whatever. But
mhm.
you can't just Google something and be like, oh yeah, I know more than you.
Yeah,
I mean, you
I
don't. So
No way. Yep. Okay. So should we just maybe we should just go
So
to the question.
yeah, you want to do the question? That's fine. You
Let's do
picked it
that.
out, so you're doing
Okay.
it today.
All right. So this is a question that I don't know your answer on. I don't know if you know my answer on either. But um if you're gonna die,
I am going to.
if we're all okay, we're all obviously gonna die. Would you want to know the day you were gonna die or not?
What I want to know the day. So
Like
I
you were
mean,
like,
I saw you put this in the notes. I didn't think about it deeply, but the more I think about it, I think I probably would want to know, just because if you don't know, y- if I don't know, I'm not going to change anything
mhm,
about how in terms of how I live, right?
yeah.
Because I don't know when I'm going to die. I'm just going to keep going. But if you told me, hey, 2061 on October 1st, you're going to die, I can plan first of all. So I would. There's so many things that I would just, being frank with you, I would say fuck my student loans. I'm not paying them.
Yeah.
If I can't pay them off by then, I'm not paying them. And then
Right.
I could travel. I could do whatever I wanted.
Mhm,
You could. I think the big thing for me is you could come to terms with it.
mm,
I would personally like to come to terms if I knew I was going to die. Like I could
right.
come. I'm not religious, so I'm not going
If
to
you knew the
like.
date you were gonna die, because we all know
Yeah,
we were gonna die, but if you
yeah,
knew,
yeah. I'm not. I mean, I'm not going to like talk to Jesus or
mm,
God or whoever. So I'm not going to come to terms with that. But like, at least in my own mind, I could come to terms with it and be at peace with it. And then I could do whatever the hell I wanted for
yeah,
however long I had left.
right.
So
I think it's a twofer. I think if you know, I don't know. I don't think I'd want to know because if
that's
I
what I
would,
figured. Yeah.
if it's, in my age, in 10 years, I know I'm going to die. Like you, I think I'm going to treat that a lot differently. If I in my mind, I think I'm going to live to 100.
Yeah.
And so planning for that, I'm planning to live to 100. But
Yeah.
if I know at 39 I'm going to die, like, yeah, like, man, I am doing everything differently.
I mean, strippers and blow. If you're dying at
No,
39,
I'm not doing anything. I'm not doing
no,
any
yeah.
of that stuff. I'm gonna,
Oh, yeah.
um, in terms of maybe traveling, not caring much about having debts, just
Yeah. You do.
different things that I would try to prepare for my future. You know,
You
I
could
don't
just go
know,
live
family.
in Guatemala, be a bum. Like you could do whatever you wanted.
Mhm.
So I personally would. Like then you could like set up. You and I don't have kids, but if you have kids, you could
Mhm.
set them up because
Yeah.
maybe you're not saving for their future as much as you should be.
Right.
But hey, I'm going to die in 5 years.
Yeah.
Then you just start dumping money to them.
Right.
Whatever you
No.
want to do. So I think
So I see the pros and the cons and pros and cons in both things. And I've had this discussion, and I brought this up because I actually had this discussion in church. And so
yeah.
so,
Oh,
so and we all it was like a male church group, and we all had different answers. And I thought it was so interesting that um, one of the was funny. One of the doctors in my male church group, he
mm,
wanted to know.
yeah.
He was like, I want to know for sure. I definitely want to know because I want to plan it. Like I want to, and
Hell yeah.
maybe my opinion will change. Maybe I'll want to ultimately plan that one day. But I think like just know, like, I don't know, you're gonna die, but then if they tell you like this is the day, then
Yeah.
you're like, it's real. Like
Yeah.
that's makes everything so much more real. And
So ignorance is bliss, is what you're saying.
essentially, yes,
Yeah.
exactly. Ignorance. Yeah, I'm like, I'm gonna die probably one day for sure. But if I know, like you said, this certain date, you're just like, oh man, like, okay,
Yeah.
it's happening. Like, and then I don't know, you could go around and ask different people, each day that everybody knows the day they're gonna
Mhm.
die. And so then you're like, when are you gonna die? How long are you gonna live? What are you gonna do?
Yeah.
And so then you start like planning your life based on, and then you could go down to like how you're gonna die, like you could even, subsets of you're gonna
Oh yeah.
die
You
of
go
old
real.
age, you're gonna die of tripping down the street playing pickleball. Like I don't know, like
And then you
some
probably get people that would, if they knew how and when, they probably try and prevent
right,
it, right? Like you wouldn't play
right.
pickleball that day and see,
Yeah, pickleball that
and see
day.
if it worked.
See if it changes. And yeah, we won't
And
get into all of it.
then you throw off the time space continuum and you just fuck everything up. So
And then you get a time machine and
it's
it's all done.
it's an interest. I mean, it's a deeper discussion because I think as Americans we struggle with death. A lot of other cultures like embrace it, like it's part of
Mhm.
life. I forget Spanish, some sort of Spanish, but they have like the Day of the Dead, right, where
Mhm.
they
Right.
raise the dead, they redress them, and all that kind of stuff. So a lot of other cultures are more in touch with death. We as Americans are just scared of of
Yeah.
death, and maybe you less so because you believe
Hmm.
in the big man, so
Hmm.
you believe that there's
Greater,
something after.
greater power. Yep.
Yeah. So
Hmm.
you don't believe that we're just like gonna die and
Hmm.
run on
Just
the ground.
disappear. Right.
Yeah.
Yeah. Yeah. I mean, our
So,
bodies. Yeah, obviously, but
well, yeah, but like our
our
soul or
flesh.
where you want to
Yeah.
call
Yeah.
it
Your
is not. Yeah.
soul can go to heaven or hell. Yeah,
Yeah.
for sure.
So,
And and so yeah, there's we won't. Yeah, all of the interesting life after this short period of time that we're here on Earth, but yeah, just to know. I don't know that I thought that was. I think now more I see that why people would want it to know.
mhm,
And but I think you're right. Ignorance is bliss, and I think that's maybe that's a very much an American thing. I don't know, like that.
yeah.
I
It probably says more about my life that I would change it, right? Like that
yeah,
I am not
yeah,
living probably the way I should or the way that I want to. If I
yeah,
would change how I'm living, if I knew I was going to die in 10 years.
right.
So,
And I think everybody. I think if, you found out in 5 years from now you're going to die at 5 years. I think everybody would be like, okay, yeah. But
yeah.
which could happen. You never know.
I mean, the trick is like most of us know when we're going to die. The average age is like 72. So if
Mm,
you're average, you're looking at
yeah,
72, whatever it is,
yeah.
right?
So I think it's
Obviously,
77. I think it's
there you go.
77. But
See, so maybe it'll
uh,
be 100 by the time we get to that age, but most of us know. And then you get, if you want to get real deep, most of us probably never live to begin with,
true.
right? We're kind of just walking around as fucking zombies all day.
And I think what the younger generations are supposed to be living longer as well. I don't know if it's just because there's less pollution or there's less
Hmm.
whatever it is. I think we continue to live longer and longer, and then I think you get into your your quality of life.
Hmm.
And so yeah, you're alive. You're
Yeah.
80, you're 85 years old, or was there
But you're like shitting yourself. You can't walk. You don't know who you are. Like,
yeah,
yeah,
like, and so you're like, oh yeah, you're definitely alive, but are you like what's your
physically you're
quality of
alive, but
yeah, physically you're alive, but
people,
like it's and that goes into the whole dementia and Alzheimer's and yeah, incontinence and
hmm,
all those things that wonderful things that happen as we
yeah,
continue to
that gets
age.
into like the medical top, like euthanasia. Like,
Mm,
should we like let people, if they're like,
mm,
if they're of mind and
mhm,
they know that physically they're just deteriorating, like, and
mhm.
they're watching their spouse or their kids or whoever take care of them, and they're like, I don't want to fucking live like this.
Yeah.
Like, should
Quality,
we give them the option of be like, hey, just give
yeah,
me some medicine and like let's call it a day? Like,
right. Yeah, quality
which
of life.
I would
Right.
be for, but that's a different, that's a different discussion.
Yeah, maybe that's a different question
So,
that we'll ask
mhm,
one day. Your quality, and I,
euthanasia.
I think I would be, and I've always thought about that about myself. If my quality of life is where I'm happy, and
Yeah.
why be around? Like why be around if,
Yep.
and
I mean,
that's
especially in your case, if you believe in the afterlife,
mhm,
like you're like, okay, fuck it, I know what's coming for me.
yep,
Like,
I know where
it's
I'm going.
it's better than what's here.
Hmm.
So let me go. I've lived my life here. Like, let me.
Yep.
So I mean, I think it's this. We get into this. It just is. This is why we talk longer, is because things just come up.
Yeah.
But it's crazy to me what we allow people to choose and what we don't allow people to choose.
Hmm.
So you can choose to go to war, you can choose to drink alcohol and just destroy yourself, but like
Hmm.
you can't choose to die with dignity at,
Right.
like, your body's falling apart. We should allow you to choose
Hmm.
that it's
Yeah.
time to go. If
Yeah.
you're of sound
A
mind.
sound
If
mind. Right. Right. Yeah.
if everything else is like your mind is working and but nothing else is, I don't know, why do we not let you? It's
Yeah.
crazy. We let
Hmm.
people, they can choose to or not choose to do a whole bunch of stuff, but dying is not how is not something we
Right,
let people
right.
choose.
And I wonder if, and I don't know this, I'm speaking, I wonder if in other countries they allow the people to decide these, okay,
Hmm.
I'm of sound mind, I can make that decision for myself. I don't want to be here any longer. I don't know if that's
That'd be something our foreign viewers could answer if we have
yeah,
any.
for real. Yeah, yeah. I'll have
I'm
to
sure
look.
it's culturally related in
Oh,
terms
I'm
of
sure. Yeah, yeah, definitely.
not even getting into does the state, the country, whatever, allow you to do it. Like, if they
Hmm.
allow you to do it, fine, whatever. But
Hmm. But
so, yeah, good.
well,
All right, guys, that'll do it for today's episode. As always, if you enjoyed the content, please like, comment, and subscribe to help grow the channel, and we'll see you in the next one.